Most blood pressure readings are wrong, not because your doctor is careless, but because when you talk or you are sitting down in a certain position with the bladder full, it can actually increase your blood pressure, which might look like abnormal. And in some cases, you might get started on blood pressure medications when you actually don't have high blood pressure. And on the flip side, we see that many of the high blood pressure might get missed with the wrong technique. So in this video, I'm going to talk about 10 different mistakes you can make when you check your blood pressure and how to identify it and fix it. So stay tuned. Mistake number 1, checking your blood pressure with full bladder. And this might surprise many people. Yes, full bladder, it causes the sympathetic response in your body, which is fight or flight response. Your heart rate increases and it tightens your blood vessels, and that can cause increase in your blood pressure, which is a false reading. And in some of the studies, it has shown that the blood pressure upper limit, which is the systolic blood pressure, can rise up to 30 points in some people. And this is not a small difference. So when you check your blood pressure, make sure you go to the bathroom, empty your bladder, and relax. Mistake number 2 is checking your blood pressure only in one arm. And some people might use the same arm again and again to check their blood pressure. But we know that the blood pressure may vary between the two arms. And according to the large review published in British Journal of General Practice, says that a significant difference of blood pressure between the two arms may suggest underlying vascular disease. It might be related to your subclavian artery or brachial artery. The American Heart Association suggests to check the blood pressure in both arms and then using the arm with a higher blood pressure reading consistently moving forward. So check the blood pressure in both arms occasionally and then use the arm with a higher reading consistently. So that's the key. Number 3 is bad sitting position. And this happens consistently in homes and in clinics. If you are sitting cross legs with no back support and feet dangling, that can cause significant increase in your blood pressure. In fact, some studies show that sitting without back support may increase your blood pressure by 10 to 15 points. So here is the setup. Your feet should be flat on the ground, your legs should be uncrossed, and you should have a back support. You should relax when you take your blood pressure. These are simple things, but accuracy matters. Mistake number 4, wrong arm position. Your arm should be at the heart level and should be rested, not hanging down, not in your lap. Why? Because gravity can affect your blood pressure. A recent randomized controlled trial have shown that wrong arm position can affect your blood pressure by 10 to 15 points. So the right setup is get your arm rested on the table, put your cuff at your heart level, and it should be relaxed. Mistake number 5, measuring too quickly. If you just walked into the clinic, you have driven through the traffic, you might have argument with somebody and you're rushing into the clinic, that is not the right time to just take your blood pressure. Medical guidelines state that you should rest for about 5 minutes before you measure your blood pressure because all these things can affect your sympathetic nervous system and increase your blood pressure falsely. So in my clinic, I have my patients wait for about 5 to 10 minutes, relax, sit quietly, no talking, and just breathe normally in the room before we take their blood pressure. Mistake number 6, coffee before measuring your blood pressure. Coffee has different impact on different people, but research showed consistently that taking coffee can increase your blood pressure temporarily. So the right approach is avoiding coffee 30 minutes before measuring your blood pressure. Similarly, alcohol has effect on your blood pressure. Many Cochrane review has shown that alcohol can decline your blood pressure temporarily, but later on it causes rise in blood pressure. So if you drank recently, it might not reflect your true baseline if you're measuring your blood pressure. So avoid drinking coffee or alcohol before measuring your blood pressure. Mistake number 7, wrong cuff size. If you are using a large cuff, it can falsely reduce your blood pressure reading. On other hand, if you are using a very small cuff size, it can falsely increase your blood pressure reading. And I see that all the time in my medical practice. Range. So measure your arm circumference, and it is important to use the cuff size which is appropriate in that range. And always place the cuff directly on your bare skin. It should not be placed on your clothing. because that can affect the blood pressure reading as well. Mistake number 8, trusting one reading. Your blood pressure change all day long. It could be your food, it could be movement, it could be talking, it could be stress, it could be walking or sleep. They all affect your blood pressure. So just measuring one time will not diagnose you with high blood pressure or low blood pressure. It should be monitored over time. So when a patient comes to my clinic, I don't just measure one-time reading and diagnose high blood pressure. We have to trend and monitor the blood pressure on multiple occasions. That's where the home monitoring is very important. So you have to trend your blood pressure over days and over weeks to finally come to the conclusion that your blood pressure, what is your blood pressure's baseline is, because it varies according to your situation. So don't trust one reading. Mistake number 9, using your wrist monitor incorrectly. Now, wrist monitors are getting more popular because they are convenient, but it is also very common to see incorrect reading with these wrist monitors. Your wrist has to be at the heart level to give you the accurate reading for your blood pressure, and that is very difficult to maintain consistently as outpatient. One population study found that the wrist monitor users have consistently higher significant measurable errors in their blood pressure readings. So using the cuff for upper arm is the gold standard for home monitoring. I want to mention another 2 aspects of blood pressure as well: white coat hypertension and masked hypertension. These are very important to differentiate when it comes to high blood pressure. So what is white coat hypertension? White coat hypertension is defined as high blood pressure which is measured in clinical setting. So when you go to your doctor's office, you might become nervous or anxious looking at your doctor or medical staff. That causes sympathetic response of the body, and it can increase your heart rate and your blood pressure. So the research which is published in Hypertension has shown that people who are diagnosed with white coat hypertension don't have the same cardiovascular risk as people who have consistently high blood pressure readings. So one reading in doctor's office is not enough to call it as blood pressure patient, because many of the studies have shown that 15 to 30% of patients who are diagnosed in the clinical setting for high blood pressure are actually white coat hypertension patients. And these patients, they don't really have high blood pressure and they get started on the blood pressure medications. So it is important to do the home monitoring with proper trending of your blood pressure over the period of days and weeks to know how your blood pressure is getting fluctuated or getting affected with the day-to-day activities, and it is a real hypertension or white coat hypertension, because 2 entities are different and their treatment is different. All right, the second one is the masked hypertension. This is the most dangerous one. You go to your doctor's office, they check your blood pressure and your blood pressure is normal, but it is not normal. It is very high in your day-to-day life at home. Why does this happen? This might happen if you have poor sleep, you have work stress, you have metabolic dysfunction, insulin resistance, and other metabolic factors driving that blood pressure high. So these patients, they get missed in the clinical setting when their blood pressure is normal, and they don't get to have the same treatment. Research has shown that masked hypertension carries the same cardiovascular risk as somebody with sustained hypertension. So it is very important to identify people who have masked hypertension, and for that I use ambulatory blood pressure monitoring, where we can monitor your blood pressure at home to see how your blood pressures are running from day-to-day life. It is very important to distinguish this condition from other conditions so that we can treat you even better. This is especially common in high-performing individuals, people who have poor sleep, or people who are chronically stressed. And in many patients, you completely have no symptoms. So this can easily be missed. I'm Dr. Neetu Sharma. I'm double board certified nephrologist and metabolic health expert, and I bring new insights every single week for you. Don't forget to subscribe to this channel and share it with your loved ones who might benefit from it. See you next time.